So there's multiple ways that different surgeons approach the lower lid region when they're talking about a lower lid lift. And what do you think about the different procedures?
Yeah, there are really two main categories. One is what's called a transconjunctival blepharoplasty, which basically means making an incision on the inside of the lid itself, going down and removing some of the excess fat within the lid and the eye itself to reduce some of the bagginess. We're not big fans of that procedure because we find that most people also have excess bagginess of the skin and the muscle itself, and they're better off addressing that.
Yeah, so it used to be the case that a lot of surgeons would go in, you'd see that sort of fatty look under the eyes. They'd go in from the inside of the eye, make an incision, remove some of that fat. Those patients often did well early on, the first 6 months, year, even 2 years you could do well. But as we all get older, you lose some of the facial fat, and those people would look a little bit hollowed out, gaunt. And so we've really moved away from that procedure, and now more often we find lower lid lifts through a skin incision is better for us.
So the better approach that we find is to do what's called a skin muscle blepharoplasty. And basically what that means is making an incision right along the lower part of the skin crease just below the eye lash line and into the natural crease at the corner of the eye. Through that incision, we're actually able to go down, add a little volume to the area under the eye if we need to, and then tighten that skin and muscle and remove the excess to really give a nice, flatter, tighter, more rejuvenated look to the eyelid itself.
Absolutely.